Hi, my name is Thomas Foreman, and this is my lumbar spine examination video for Module 5 of the Sports and Exercise Medicine Diploma. This is Libby, she's my patient for today. Libby, do you mind if I examine you back today?
No, it's fine.
And are you in any pain?
No.
So before I examine Libby, ideally I'd like to take a full history to figure out if she has any leg pain or any back pain at all. So first of all then, Lib, can I ask you to walk towards the end of the room and back for me? So when Libby's walking, we're looking for a gait there. Any signs of an antalgic gait, which may suggest that the patient is suffering from sciatica. Any limping, anything like that really. And now if I ask Libby to turn to the side of the camera like this, and just lift your top up just at the bottom, that's it. So now we're going to inspect Libby's spine. We can also inspect her shoulders to make sure they're parallel, but then from the side. So if you keep your head in the neutral position for me, we're going to have a look here. So we've got a normal cervical lordosis, a normal thoracic kyphosis, and a normal lumbar lordosis. So the shape of Libby's spine is absolutely normal there. And looking from the back, looking for any signs of a scoliotic spine, so that's an S-shaped spine. So if Libby turns her back there, in patients we'd expect the spinous processes to make an S shape. There we are, that's fine. So then, now we're going to palpate Libby's spine. Starting from the top, I like to do it from the top, even if I'm examining just the lumbar spine. So spinous processes from the cervical, working our way down onto thoracic spine between the scapula, all the way down here to the lumbar spine. Any pain at all?
No.
Then I like to palpate the paraspinal muscles next. Let me know if there's any pain there. Down here. Next, the sacroiliac joints. Put some pressure on the posterior superior iliac spines and press in with our thumbs there. Any pain there?
No.
Fantastic. Okay. Now we'll move on to movements of the spine. So if I can ask you, Libby, to touch your toes for me. And if you turn to the side and do it as well, just so that we can see on the camera. And keep it down there for me. As we can see, Libby's quite flexible. She can touch her toes. And she's got a normal flexion of her spine there. Next, we're going to check for extension. So if you could bend backwards for me and see how far you can go. Supporting the patient there. Perfect, well done. Normal extension of the spine. Next, if you face towards the camera for me, can you run your right arm down your leg? That's great. Normal lateral flexion on the right hand side and the same on the left. Brilliant, well done. Again, normal examination there. Next, I'm going to ask Libby to take a seat on the sofa. I'll apologise in advance that for this video I haven't got the normal bench that I would use in the previous videos. Libby, can you put your hands on your hips for me and bring your right shoulder in front of you? And back to normal. And then your left. So we're checking for rotation of the spine here. This is actually examining the rotation of the thoracic spine more than the lumbar, but obviously they're attached, so you can get abnormal rotation of the thoracic spine with lumbar spine pain. Fantastic. So Libby, if you can stand up for me. And this time I'm going to ask the camera to come a bit closer and face Libby towards the wall over there. Right, we can do something called Schober's test now. I've already pre-marked Libby on her back here with the X's, but what we do is we look for the posterior superior iliac spines, which is there. Bring our thumbs to the middle and place an X on the spinous process. We then go 10 centimetres above, which I've pre-measured and marked. And what we're looking for here is if Libby was to touch her toes again, we're looking to see a size difference here. Normally, we did, so it's originally 10 centimetres. Now we're looking at 13 centimetres, which is normal. So obviously where the spinous processes are there, we've got the spinal ligament at the back, and that's normal examination there for Libby. So what we'd also do at this point, while the patient's standing up, is examining their shoes, looking at the bottoms, looking for any wasting of the heels, and any different markings on the soles. Hers are quite normal. There's a bit of wasting on the lateral heels, but it's quite normal for most people. The other thing we check for an inspection of the lumbar spine is for any previous surgical scars. Have you ever had an operation on your back? No. Any signs of muscle wasting around the lumbar spine, or indeed around any part of the back, including the shoulders? And for any bruising or obvious lumps and bumps there. Again, if he's got a normal lumbar spine. Fine, so next we're going to move on to neurological examination of the lower limb. So if I can ask Libby to lie down on the couch. For the purpose of the examination, I'll just examine Libby's right leg, but ideally I'd examine both. So, we've been through this before on a different examination video, but if you can let your legs go nice and floppy for me. And have you got any pain in your legs at all? No. So first of all, we'll check for tone. Nice and floppy for me. That's okay. Then we'll check for a clonus in the feet. Just normal there. Well done. Now, with your right leg, can you lift it up in the air for me? And keep it there. Can you push against my hand? So Libby's obviously lifted against gravity, and she's now pushing against my hand, which is normal. At this point, we'll do a straight leg test, and we'll dorsiflex the foot, and ask if Libby's experiencing any pain around the back of her leg there. So patients with sciatica or piriformis syndrome, for example, may experience shooting pains down their legs when you dorsiflex their foot. Right, next, I ask you to bend your knee up for me. And can you kick out against my hand? That's it, and then pull me towards you. That's great. So we've got normal knee extension and flexion there, and straighten your foot up. And can you point your toe towards your head? So well done. And then push against my hand. So we've got normal ankle dorsiflexion and plantar flexion there. And can you push in against my hand? And push out. We've got normal inversion and eversion of her foot as well. Can you press in against my hands? Normal adduction of the legs. And can you adduction, and then can you push out? Normal abduction of the legs as well. And one more time, if you lift your leg just slightly off the bed and push in against my hand. This is checking extension of the hip, which is normal. For patients who also experience sciatica, what we can do is we can do Faber's test, which we've done in a previous examination video, where I asked Libby to bend her knee up, place her foot over it at the knee. What we do is we apply some pressure to the right side of the hip and then push down on this knee to experience any pain there. Some patients will also experience sacroiliac joint pain for that as well. Next, I move on to examine Libby's reflexes in her knees. Unfortunately, I don't have a tendon hammer, but I check the patella tendon, which lies about here, and I check the reflexes in her ankle as well, by hitting the Achilles tendon there. The other thing to check is the dermatomes of the legs. People with sciatica and obviously the nerves run out of the lumbar spine supplying the lower limb may be experiencing some numbness in the dermatome regions of the skin. We've got the L dermatomes that supply the L1 and L2 that supply the thigh area. L3 supplies the knee. L4 lateral leg. L5 the inner leg and foot, and S1 the bottom of the foot there. To complete my examination, patients experiencing back pain may also be experiencing incontinence, and as we know, one of the surgical emergencies is cord recliner and cord compression, so I'd also complete my examination with a PR exam. Patients with back pain may also need imaging such as plain radiographs, or even if they've got numbness, muscle wasting, or anything like that, or weakness, they may actually just move straight onto an MRI. So Libby, if you stand up for me. That completes my examination of the lumbar spine. Again, to further examine, I'd fully examine the hip joints and examine the thoracic and cervical spine in more detail. So thank you.